financing, like what impact, for instance, did the COVID have as a facility on your human resources, both your clinical staff, your administrative staff, and all of that, and also on your financing as a facility? And what indeed were you able to do, and how have
Thank
you
you
been
very
able
much.
to
Yeah.
manage that? And what
In terms
lessons
of
can we
human
learn,
resources, we
in
all
being
know
able
that
to
our staff are
manage
the
these
most important
resources and bounce
resource
back
in our practice.
forward, not just
If you
better,
don't
but
have
forward.
good
Thank you.
professionals working with you, working within your standards, at the end of the day, like we said from the previous speakers poll, at the end of the day, you not have satisfied patients. So truly, the pandemic hit hard on our human resources and finances. In terms of human resources, I can tell you at some point in my own practice, during the beginning of the lockdown, my patient base, patient traffic dropped by over 70%. And I still had the same number of staff. Reason it dropped was obviously for the common reason was they were scared anybody going to the hospital. They have that impression if they check you, you have a fever,
Wow.
they'll just refer you to a COVID center that this is a suspected COVID case because that was the classic presentation of the first variant that came out. So most of my patients, for some reason, stayed at home. I'm sure, I guess they were self-medicine. So for the first 2, 3 months during that lockdown period, there was low traffic. So at the end, I had the options of either laying off my staff because my income had reduced significantly, or I had a meeting with them and spoke to them, gave them the ability to work from home, some of them, and I discussed with them about reduction in salary during that period. That wasn't my intention, but it was better than laying them off. When it came to financing, we as private healthcare providers were excited when we heard the federal government of Nigeria, through the CBN Intervention Fund, had released, I think, was it 25 billion naira to the healthcare sector to intervene due to this COVID. And the interest rate was going to be single digits, I think 7%. With the commercial banks disbursing it, they'll charge an additional 2%. That's a total of 9% interest for that credit. Immediately, I called my bankers. Luckily, some of the commercial banks, with the economic downturn, they started bringing out packages, their own packages, with
Again, yeah.
significantly lower interest rates. For the first time, a bank approached me and told me he was willing to give me a loan at 16% interest per annum. And this is the best I've ever got since I've been making attempts to access credit. So I saw that it was something workable. It was something my facility needed to recover from this pandemic, and I went for it. So it's not been easy accessing finances, trying to keep your staff, not lay off when the chips are down. But luckily, I can say we're picking up gradually now. The staff, a couple of them could not handle the whole brunt of the pandemic. Yes, we know one or two would leave, especially with the brain drain now. When the United Kingdom sends a plane to come pack our doctors, nurses, and health workers, even those without working visas. Luckily, they were intercepted by the Nigerian Immigration Service and they turned them back. That's how bad the brain drain
Well,
has been. The average medical officer's lifespan, working lifespan in a private hospital now is less than 6 months. Within that 6 months, they have written their club and they're off to the UK or they're off to Australia or off to the US. So we are going through a whole lot now, and I'm sure the government will need to do
wow.
more because at some point there'll be no more doctors and hospitals in our facilities. So I'm glad this forum is giving us opportunity to talk.
Yeah. Thank you so much, Doctor. Yeah. We're really, yeah, we're really happy that we're able to actually have this conversation to understand the impact of this crisis, and of course, on top of that, the complicating health human resource crisis that we are facing, and how you've been able to manage that through conversations, through your principles. Like some organizations decided that, look, this is a crisis, we're going to go through this together, but we'll have a conversation on how we will do this going forward. We don't want to lay off anybody. So the fact about connecting with your staff critically and creating some kind of connection for them to continue in employment, to continue to have some security, but within the scope of how the business is flourishing. And of course, the issues about financing, the reduction in uh, patient flow, but the important thing about scanning our environment for information, making sure that we key into opportunities for financing, just like you did. And that is helping us to, bounce back. Timile, yeah, over
Fantastic.
to you.
Fantastic. Thank you so much, Dr. Emmanuel and Dr. Michael. It has been absolutely insightful so far, and we really are delighted to have had you. And we are certain that every participant and everyone that has joined in has definitely learned a thing or two. So we're just going to go back real quickly to both Dr. Emmanuel and Dr. Michael now for the parting shots and parting words. However, I want to create a bit of context for what it is that we would be speaking to. And I want to explore our imaginations and allow us to quickly speculate that if we had the luxury or the opportunity to have prepared for the pandemic, three key things that we most likely would have done differently if we had the luxury of time. So paint a picture in our minds that if we were in 2019 and we were told that in 2020 a pandemic was going to hit of this magnitude, what are three key things that we think are absolutely important and we would have done differently in preparing ourselves for the pandemic? So I'll get Dr. Michael's thoughts first, and then we'll get Dr. Emmanuel's thoughts as well before we close up this session.
I don't blame anybody for it. Was like a hysterical conversion illness, Everybody was panicking. From top, the so-called advanced country, the so-called low country, we all do this today, listen to the WHO, do this today, don't do this one today. So I don't really blame anybody. But one thing especially let's come to Nigeria, we can do. When such thing happen, that to say mental thing, I was thinking about it the other time, the mood of the nation. We have to organize ourselves. You don't lock somebody in and say, don't come out. You have nothing to give to him. Because the economy of Africa, especially Nigeria, is from hand to mouth. People will go to the market, sell and bring what they will want to eat for the day. And then you suddenly lock them up. You don't provide anything. And the next thing you see, somebody will just put the forces outside. And a hungry man is an angry man. You remember the one from, I think, Abuja, the young taxi driver that went there, it was, because he must have been there. The children are crying, and everybody's there. He doesn't know what to do. He has to go and look for food. Yes. Financing also, especially when it comes to the, well, I can tell you, there was a time THT was talking, giving us some information how to manage ourselves. Well, we appreciated it in those days, not financially, but at least do this in your network system. But what we can do now is at least we know the evidence that this disease will be with us for a long time. Proper planning give us how we can then do, especially in the mental health, what we are talking to. Consulting, we should also establish some area where you counsel. Because so many people have lost so many dear ones. The moods is there, depressions are there, I've been seeing it. Depressions are there. So you have maybe I don't know what you will do as a health management section. Have some also have some people who will be consulted because there's a lot of problem in this country, especially here I'm practicing. Because COVID-19 has done terrible things, unemployment, drug abuse, enlightening. Let's talk, just like we are doing. Open up, employment, give it to the people because it has launched the whole economy. And then sections where people can go and then listen and talk like we are doing. It will be beneficial to this country. Otherwise, it's going to be tough, and it's going to be tough. Drug abuse is an increase. Sexual violence is there. Domestic violence is there. So, I don't know, the whole thing is on government. There's nothing to be about. I say, individual, you do your very best. I think you get me right? Hello?
All right, thank you so much, Dr. Michael. Yes, we did get you. Thank you so much. We are indeed glad, and we have taken some of the points that you mentioned. Thank you so much. In wrapping up, you mentioned very important things about the fact that it wasn't just a health crisis. There was the socio-economic implication of it. There was the psychological support that should have been in place in terms of helping individuals through that particular process, and we really are glad that you spotlighted some of those things, and also the fact that this isn't just something to be done as individuals, but we must continue to work together with that goal of making Nigeria healthier, as we are committed to our total health trust. So I'll just very quickly go over to Dr. Emmanuel, and let's just get your thoughts regarding what I mentioned earlier about key things that if we had the opportunity to wind the clock back, what are those things we probably should have put in place in terms of preparing ourselves, for exactly what it is that we have been through? Because the truth is that this wouldn't be the last of its kind.
To add
And so
to
we
what
must be able
my
to document some of
co-panelists
these
have
learnings and be
already
able
talked
to
about,
implement them
just like in
subsequently as we
biblical
move
times
forward. So
when
over to you very
Joseph
quickly, Dr. Emmanuel, for your last words.
foresaw the famine coming out in Egypt, and he told the Pharaoh the story of how he had to save for 7 years that will handle the 7 years of famine. So I think if in 2019, earlier in 2019, I had seen this coming, I would have made adequate financial arrangements in terms of stocking supplies, especially PPE, stocking supplies, including drugs. Just like my co-panelist has mentioned, he succeeded at doing that. We know how bad it was when China came to a lockdown. The box of face masks that used to go for 1,500 naira went as high as 20,000 naira for the first 6-7 months of 2020 last year. Luckily, they were able to find out that even using a face mask made from cloth could give you some level of protection. So that helps in that regard. So you can see a common PPE as low as a face mask was so expensive. Latex gloves, they went off the roof. So if I had known this, I'd have stockpiled better on PPEs, drugs, and consumables I use in my hospital. Also, the universal precaution and WHO standards that encourages us to practice hand washing and other universal precautions as part of our daily practice as healthcare practitioners. I would have long ago imbibed this as a culture to my workers. If we had done this, by the time the issue of COVID-19 pandemic came, it would not have been a big deal again about hand washing. You did not need to force your staff to wash their hands regularly. You would not have to educate them repeatedly, because at that point, it will be part of their culture. So I hope with these few points, I've been able to pass across my message. Thank you.
All right, Thank you so much. Thank you so much, Dr. Emmanuel. Now, the beauty of the thoughts that we had shared in closing are these are things that we can still do today. So we don't even necessarily have to wind back the clock to 2019 or 2018. These are things that we can actually still do now. We can prepare ourselves better and not allow the gains of the chaos and crisis to actually go to waste. I believe it has been a rich conversation. Thank you so much. At this point, I would hand over to Dr. Deola Majagbe if she has any final thoughts just before we wrap up this panelist session.
So, all right. So, thank you so much, Simile. Thank you, our panelists. I don't think I have any other thing to say, but to say that COVID, again, I will reiterate what Professor Shibogun said the very first day, has taught us many lessons. And it's time for us. Parts of recovery, parts of resilience is to actually learn those lessons and, imbibe them as organizations, as people. There are lots of action points that have come from here. And just like Dr. Michael said, one of the things as THT we aim to do and hope to do is to be able to at least put a compendium together of these lessons and share them widely, because there's something for you and I, there's something for your organization to do. And, create the provider forums are that way where we are creating a culture of learning, both as an organization for us and, in fact, as a community of practice for our providers. So, thank you very much. That's all I just have to say. Let's be good students of all of these resilience lessons, and I am sure that we'll be better. Thank you very much.
Thank you so much, everyone. Thank you for staying tuned. Over to you.
I have dreams for my future and my family. I dream about building my own business. I dream about traveling the world. I dream about watching my children growing up and celebrating important milestones with them. I dream of growing old, content with my spouse. I dream about seeing my grandchildren take their first steps. But life is uncertain, and the health of our loved ones is our only true wealth. What if my child got very ill? What if my spouse needs surgery? What if we had a serious accident? What if we had a challenging pregnancy? Medical cover is so complicated. I'm not sure I would know what medical treatment we could get, from whom, and what it would cost. I wish I could have peace of mind that I can access the care we may need now and in the future. I wish medical cover was easier to understand and easier to access. At Liberty Health, we understand that worry is a thief of joy, which is why, in your country and across Africa, hundreds of thousands of people have accessible, affordable, and understandable medical care. They can enjoy the present and have the peace of mind that if something bad happens to them or their family's health, they are covered. From taking care of your everyday health to serious conditions and emergencies, with us, you are covered. Whatever benefit plan you're on, so you can focus on cherishing every moment with your family. Liberty Health, working together to make Africa healthier.
Everyone wants the best things out of life. The best friend, the best partner. At Total Health Trust, we understand partnership. Like friendship, it's about giving and commitment. There is nothing better than having a great partner with a great purpose. Purpose fuels, purpose drives, purpose enables. At THT, we move and breed our purpose, working together to make Nigeria healthier. We cannot promise that life won't be tough, but you can be assured that healthcare can be easy. Whatever life throws at you, you shouldn't have to bother about your HMO. The reason is obvious. We're committed to you. We put you first. We feel what you feel. We walk the talk and show up through the good and bad times. You can count on THC as your reliable partner. Strong and kind, resilient and responsible, experienced yet modern. Our purpose is simple. We're here to make you healthier.
Yeah, so thank you, ladies and gentlemen, our viewers all around Nigeria, for staying tuned and listening to what our doctors, those from the studio and those from the virtual angle, what they had to tell us. I want to take this time to thank Dr. Emmanuel. I want to thank Dr. Michael. I want to thank Dr. Timileyin and also Dr. Adeola Majiagbe. In the words of Dr. Emmanuel, he said the lifespan of every doctor, an average doctor in Nigeria, is maximum 6 months. 6 months, it means that we may be losing the doctor for another country. Let me beg you, doctors, make I beg una now. Make I beg una. You don't know, say, if you come out for Nigeria as a doctor, make we say, okay, all doctors don't go finish. Una they give room to native doctor to take over our hospitals. Oh. Before you know now, you go see shrine for one hospital. When you enter, you go just, for a hospital. So please, I beg una, make una no go. We there together. We build Nigeria together. So ladies and gentlemen, thank you. So let me also bring to your notice that we have members of the National Health Insurance Scheme right here in Nigeria, right here in the studio. We have the members of the NHIS. They are here live to view, to be part of this great program of the Total Health Trust, member of the Liberty Group of South Africa. Thank you, NHIS. Thank you for coming. We love you. You are excellent people. We will keep on making you proud. Okay. On this note, it's time to go into the freebies. Remember, 2 days ago, some hospitals won in the raffle draw. Yesterday, some other hospitals won in the raffle draw. Today, maybe it's your hospital that will be part of the hospitals that will win in today's raffle draw. Excellent. So if I were you, I will call on God to direct the computer to pick my hospital. So in case you're ready, stay glued to your seat and watch the screen as it will roll, and roll until you see the name that will win. It's already rolling. It's rolling. It's rolling. It's rolling. Who will be the lucky winner? Which hospital will win? Oh, Living Word Mission Hospital. Abba! Living Word Mission Hospital. You have won. You have won. In case you don't know what you have won, the camera will show you right now. Camera, please. Zoom on what Living Word Mission Hospital has won. Living Word, Living Word, you are living. This is what you have won. A wonderful printer, courtesy Total Health Trust. Let me tell you what you need to know about this printer. With this printer, you can print anything, not only papers. You can print, and I'm talking about food. Put your food there, print it. You have enough food in your house. You can print rice, print beans, print documents, even print injections in your hospital. Ladies and gentlemen, you have won a wonderful printer, courtesy Total Health Trust. Wow, living faith. Now we move to the next one. Living Word. Now it's rolling again. Rolling, 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 rolling. Who will win? Modic Medical Center. Modic! Modic! goodness. Modig, you have won. If I were you, I would jump out of my seat, run around the hospital, go straight to all the wards and be shouting, THT, THT, THT in all the wards of your hospital. Then if the ward is in the 3rd floor, I will go to the balcony and jump down. Please don't jump. If you jump down, you buy job. Don't jump. Oh. So thank you, ladies and gentlemen. Excellent. We have one more roll. We have one more roll. Get ready. Let it roll. It's rolling. It's rolling. It's rolling. If I were you, I'll kneel down, wave my hand to heaven, and say, my hospital, receive fire. Then I will win. Now let's see. Who is the hospital? Who is the hospital? Keep waving. Keep waving. Ready. 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 Can you see CNET Eye Clinic? CNET Eye Clinic. Ladies and gentlemen, CNET Eye Clinic is a winner also. Wonderful. Wonderful. Ladies and gentlemen, we have the 3 winners already. We have them. CNET, Modig, and Life Reward. Yeah, wonderful, wonderful. Now, before we move to the freebies of the recharge cards, okay, Dr. Emmanuel, we can see you are still there. You are excellent. You are wonderful. I know your hospital. We are talking about the Triplet Hospital. Now, it's time for us to crave your indulgence to enable your cameras so that we can have a picture, a snap with you. Please enable your cameras so that we can have a shot with you. Everyone, enable your cameras. Let us have a snap together. It's going to be a worldwide one who will make your hospital proud. Your picture will go viral in the whole world, and then we know that your hospital exists in the Federal Republic of Nigeria. While we are doing that, join me to welcome, for the closing remark, no other person than a renowned doctor, a director in THT, a doctor whose name rings bell in the whole world. Join me to welcome Dr. Adeola Majiagbe. Put your hands together for Dr. Majiagbe. While you have enabled your camera, we will be having a shot with you anytime from now. Okay, Doctor?
Yeah, it's been a wonderful time here. You'll agree with me. It's for us on this side, it's been a exhilarating experience, for these provider forums. We also, as an organization, have learnt resilience, and we're bouncing forward, as you can see. So on behalf of the entire THT, all the staff, the provider managers, my CEO, we just want to say thank you for staying with us, for being engaged, for all of the knowledge sharing, for participating actively. We have thoroughly enjoyed it. We're happy to say that we've been able to engage your head, and we've been able to engage at the heart as well. And we're hopeful that we all will see the end of the pandemic, resilient, we're bounced back, and going forward, we will be able to say that COVID has taught us lessons, and we have been good students. We, as an organization and as a community of practice of providers, thank you for being our partners. Thank you very much. We're happy. Thank you very, very much. Bye.
Thank you, Doctor. That was a wonderful closing remark. I can see our people on the screen. I can see Dr. Emmanuel. I can see our own Dr. Michael. I can see even our own doctor from the VP East NCA driving. I can see you all wonderful people. I can see Chibuzo. I can see Suspect. I can see you all very wonderful people, beautiful people, excellent people. Now, it's time for the freebies. It's time for the freebies. I want to see if Dr. Emmanuel or Dr. Michael can win from these. So pick up your phone, Dr. Emmanuel, Dr. Michael, and everyone there, and you will see it on your screen. Any kind of recharge card numbers are there. Let's see who the winner will be. We have 4 batches. So get ready. Get ready. At the count of 4, you will see it on your screen and you will win. When you win, please just type, make a comment and say, I have won. We will celebrate you. Meanwhile, we have taken a snapshot of your screen. It's a beautiful one. We are proud of you all. So ladies and gentlemen, at the count of 4, 1, 2, 3, and 4. You have it on the screen. Let's do it. We have Airtel, Glow, MTN, and 9 Mobile. Who will win? Who will win? Let's see. Let's see. Who will win? The pin has been displayed. If you're able to win, please signify by writing on the comment box and saying, I have won. We will celebrate you. We will spread your name worldwide and say to the world that you are the fastest finger in the whole of the globe. Ladies and gentlemen, if you have won any, signify, and we will hail you. Meanwhile, let me reiterate this. Let me call the names of those who won the printers. We're talking about Living Word Mission, Aba. We have Modic Medical Center and Sinat Eye Clinic. We are so proud of you. So proud of you. Anyone? Has anyone won? Anyone? 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 Any winner there? Capadentos! Wonderful! Who again? Who again? I thought I could hear Dr. Emmanuel, or I thought I could hear Dr. Michael. But let's do it again. We enter 1. Good. Twins! That is Dr. Emmanuel's place, the triplet doctor. Ladies and gentlemen, we move to the next slide. At the count of 4. 1, 2, 3, and 4. Ladies and gentlemen, it's on board now. Who will be the winner again? Twins has been winning. Twins has been winning. Twins, like Blooming Care Hospital, Lagos, they have been the winners so far of the highest number. What can I say? What can I say? Who will win? Please check it for me. Tell me, who has won again? Who has won again? Airtel, Glow, MTN, and 9 Mobile. Who has won? Kappa, you have won MTN. Kappa, you are excellent. I'm expecting to hear twins again. Oh, let's do it. Let's do it. Yeah, we have 2 more slides to go. Now, ready. If nobody has won this, it go pay me well. So let's move to the next slide at the count of 4. Ready? 1, 2, 3, and 4. We have the next slide on board. Airtel, Glow, MTN, and 9 Mobile. Who will win again? Kappa has been winning. Twins has been winning. Who can break the record by knocking these 2 hospitals out and winning the recharge cards? Let's find out. Twins, I know you are there. We know you're managing director. We're talking about no other doctor than Dr. Emmanuel. We also know Dr. Michael. These are great men in the field of medicine. They talk wisdom. Modic Medical Center. Oh, Modic, we're proud of you. You won the Airtel Excellent, excellent, excellent. We are proud of you. Oh my goodness. Oh my goodness. What can I say? In case you don't know, let me remind you that the members of the NHIS were here and they're still here. You know, they're happy with THT. No wonder THT is a household name. THT, a member of the Liberty Group. Overcare! Airtel, wonderful. Overcare, you have won again. You are excellent. Now, moving to the final slide for this occasion. Ladies and gentlemen, at the count of 5, the last slide will be on the screen. And who will be the winners? We will make you proud by spreading your name home and abroad. Join me as I count. 1, 2, 3, 4, and 5. Ladies and gentlemen, the final screen. Who can win? Let's do it. Let's do it. Airtel, Glow, MTN, and non-mobile. Ladies and gentlemen, what did I hear? Cranial. Cranial eye. Una eyes too sharp, man. Under the sea well. Cranial eye. You've been able to win. You've been able to win. Ladies and gentlemen, in case you don't know, the members of THT are all here, catching the fun with our people. I have the HR watching right here, right now. Deborah is here. Oh, very good. Cover care specialist, you have won again. Oh, my God. Clear view. You can see clearly. Capitol Hill! Capitol Hill! Oh my goodness! Capitol Hill, you have won! Who again? Who again? Penny Eye, you are just too wonderful. Thank you, ladies and gentlemen. We are proud of you. On this note, we come to the end of the freebies and the end of this program. If you're listening to me, I tell you today that you are wonderful. You are excellent. THT loves you. Now, how do you love us back? How do you show us the love back? Whenever our patients come to your hospital, give them presidential welcome. Welcome them well into your facilities, and they will be proud of you. They will give us feedback about you, and we'll keep showing you love. God bless you all. Signing out from Total Health Trust, a member of the Liberty Group, I am Chinedu Anibema, a.k.a. MC No Le.
Everyone wants the best things out of life. The best friend, the best partner. At Total Health Trust, we understand partnership. Like friendship, it's about giving and commitment. There is nothing better than having a great partner with a great purpose. Purpose fuels, purpose drives, purpose enables. At THT, we move and breed our purpose, working together to make Nigeria healthier. We cannot promise that life won't be tough, but you can be assured that healthcare can be easy. Whatever life throws at you. Everyone wants the best things out of life. The best friend, the best partner. At Total